Okay, good afternoon, everyone. I'm Laura Dulce. I'm the director of the Kennebunk-Kennebunkport-Arundel Chamber. This webinar is part of our Kennebunkport Promise series, and I'm happy today to have with us Lindsay Toppen. Lindsay is a board-certified nurse practitioner specializing in internal and obesity medicine. Thank you, Lindsay, for being here with us today.
Happy to be here.
We appreciate it. So talk to me a little bit about what you do and what life has been like the last 6 months doing what you do.
Oh, yeah. So, I mean, I think, we're all starting to feel a little bit of COVID fatigue, right? Yeah, so, life is, my life very much like everyone's very much in flux, both at home and career-wise. So, initially when COVID started, we formed a team of hospitalists to take over at the hospital. So I actually got moved out of my office temporarily, and I'm really just now sort of getting back in to the primary care swing of things and trying to get all my patients up to date. And so, yeah, it's been a whirlwind. We don't know sort of, just like our algorithms are changing every day, our jobs are shifting and our roles are changing, much like everyone else is experiencing in their homes and careers. I also have 4 children at home. So I'm also very much with everybody else in the experiencing, their educations shifting, and our whole world is being sort of, all of our environments are being changed, right?
Oh gosh, yeah.
Yeah. Yeah. So I just wanted to kind of talk to you all today about, just sort of maintaining your health, kind of going into the fall and winter. As we know, the United States is sort of, we're up well over, I think we're at 220,000 now, cases of COVID. Not to be Debbie Downer, but it's going, we're kind of heading into, what is likely going to be a little peak here. So we're anticipating November, December, January, February, us all sort of needing to have thought through our environments and our wellness much in advance. So planning now for the fact that those months, though we've all, had to adapt to quite a lot of change, there's likely more change coming our way. So how we can best prep for those things in advance. So, I guess, our sort of cry out from the primary care realm is, now's not the time to be sort of neglecting your physical well-being. Now's not the time to decide, not to get a flu shot or not to get your mammogram, or, we are encouraging people to start following up with their primary care providers and, not sort of lapse in any of those sort of preventative care measures. Many people sort of are at home feeling like they can't safely come into the offices. And I guess, our word for you is that we have done our absolute best to try to make this as safe a place for you to come as possible. We have sort of routed all of our respiratory care to the walk-in clinics so that primary care can be primary care. So you should still safely be able to come in and get your pap smear if you're due for a pap smear, or get your mammogram ordered, and all of those sort of routine health screenings that we don't want to. We are seeing, some worsening in condition because people were fearful to come in for so many months. So now's the time to sort of, get a little bit of a tune-up pre-winter, as I'm kind of calling it with some of my patients. And then what we're kind of doing is I keep saying, we'll kind of tuck you in, make sure, we've checked off everything on your list, all of your concerns, so that you're not sort of letting them go and then needing, more acute visits in December when things are really more, when we're really getting hit with influenza and COVID increase at the same time.
Lindsay, you mentioned the flu shot, and I have gotten my flu shot. Can you explain to people why that's important this year? Because obviously a flu vaccine is not going to affect the COVID, but there's particular reasons why the medical community says go and get your flu shot early.
Right. Yeah. So, the tricky part with influenza this year, right? So, very much separate viral viruses entirely, but very much a lot of crossover in symptoms. There's certainly going to be, an influx of our population that's coming in with fever, with chills and myalgia, body aches, those things. And we're going to need to rule them out for flu and COVID. What we know is that our flu shot is not always perfect. But, I can tell you just from being here last year that, though the flu shot wasn't perfect, my patients that came in that had the flu shot certainly experienced a, not as intense of symptoms. And, certainly if, influenza takes a certain amount of time to recover from, much like coronavirus. Certainly I'm seeing a lot of patients in the office who have had coronavirus now that are still, in some cases months later, still struggling with, from a respiratory perspective to kind of get themselves back up and going. So you certainly don't want to get hit with the influenza and then follow it up with COVID, I think is one of the concerns there. And, I guess don't be fearful of the flu vaccination. There are a lot of people that say, oh, I got the flu when I got my flu shot. And that's just not true. It's not, unfortunately, it's not a live vaccination. I sort of say, it does kind of keep your immune system a little bit busy taking care of it, but let's not offend our immune system and think it's that weak that it can't be. Our immune system is fighting off hundreds, if not thousands of things every day at all times. So, putting in a little inactive virus is not stressful to your immune system. I have a lot of patients that are coming in and they're like, I'm not doing flu shot because, then if I get hit with COVID, it's going to be horrible. But, I guess our message to you is it's going to be really horrible if you get hit with both, or you get hit with one on the brink of, having been hit with the other. That's certainly going to increase your likelihood of needing to get hospitalized.
And having one does not preclude you having another. I've seen some cases where patients have both concurrently. That's
exactly
the case, right?
Yep. And certainly, increased risk of hospitalization in that case. COVID is a powerful virus, as it is proven to be, and as can influenza be, and both are highly contagious. So it's already going to be quite a stress to our resources from a perspective of the hospital, and also from just our primary care offices. We're already trying to restructure our care around winter months, and do some of us going to get rerouted over to respiratory care because we expect to be overwhelmed with respiratory concerns. So not to be on the selfish end of things, but please help us and get your flu shot.
Elena, you had a question?
I did. You were talking about preventative care, making sure that you're up to date on your physicals and things like that. But in regards to a vitamin regimen, do you recommend anything specific? I know I take a multivitamin every day. I've been actually eating an orange every day. That's crazy. But is there anything that we can do to also just put the right vitamins into our systems with potentially this flu and COVID season coming up?
Yeah, no, I think that's an excellent question. I'm a huge proponent of, if you can get your antioxidants and vitamins with your diet, that's fantastic, right? So just like you did with the orange, you were thinking, oh, this orange is a great source of vitamin C. So if you can start thinking through fruits and vegetables that provide those good antioxidants, we know from an immune boost perspective that vitamins A, C, and E, if you can sort of load yourself, with those foods, then you've got a lot of, extra antioxidants around. And we know that you'll be in a lesser inflammatory state should you encounter something like COVID. Does that make sense? Those antioxidants are in there. They're kind of fighting off all the free radicals, keeping inflammation at bay, so that if you get hit, we know a lot of the horrible repercussions of COVID are coming from this intense inflammatory state. So if you're not already in that state, that's going to benefit you for sure. So, keep your oranges going. The only, vitamin that we can't really get that we, from our food is vitamin D. And we do know that, as New Englanders, we are all deficient, sort of universally. And I was reading something recently that was saying, even if we were to go outside and expose 2/3 of our body for 30 minutes a day, we still are deficient. And who of us are going and exposing 2/3 of our body outside? So I sort of, I think it's now pretty universal that we're all kind of telling people in New England to take 1,000 international units a day of vitamin D. Many of us tell our patients to take 2,000 in the winter. You know, we know that those are sort of safe quantities. I think, you know, 1,000 for sure. Don't go overboard. It's a fat soluble vitamin. So I always tell people, like, don't go overboard and start taking 5,000 a day, because we have seen, you know, it's rare, but we do see a few cases where patients actually will say, oh, the more vitamin D, the better, but you actually can go overboard and get yourself into a situation. So, you know, 2,000 international units a day. We know that outcomes from COVID actually are worse in people who go into COVID depleted in vitamin D. There is good research to say that now. So that's not to say vitamin D is a treatment for COVID, but if you can start thinking about it now to make sure that that level is in a good range, you always can reach out to your primary care provider if you're sort of interested in having a test done for that also.
Lindsay, you talked about diet being important. How important is having the right diet, that, you know, exercising, things like that, if God forbid you do catch coronavirus?
Yeah, so I mean, I think it's incredibly important. You know, there's more and more research. I believe it was just last week or maybe 2 weeks ago that they released all of the information about obesity being a huge risk factor for worsening outcome for COVID. So, you know, we know that, you know, and it's very much you know, the more adipose tissue we have in our body, the more, especially central adiposity they're studying, the more of those ACE2 receptors, that enzyme that, you know, sort of is, I sort of tell people it's kind of the welcoming mat for COVID. So, you know, the bigger your welcoming mat, you know, the sort of worse off you're going to be, unfortunately, is what they're finding is sort of universally when they look at all the patients that had poor outcomes from COVID, you know, the more obese they were, the worse the outcome was. So, you know, now's a great time. You know, many of us have a little bit more time on our hands these days, not, you know, universally. You know, I know many of us are also homeschooling children and trying to do our jobs, which is not been easy by any means. You know, but some of our social outings have been canceled. So, you know, it's a great idea to sort of, you know, instead of sort of jumping on the sourdough bread, you know, to try to combat, you know, to try to sort of think about outdoor activities and things that we can do to keep ourselves active, you know, keep our weight down, you know, really great, you know, really great time to start thinking about just researching nutrition just in general. You know, how can I, you know, start to fit all these really good antioxidant foods into my diet, you know. Does that make sense? You know, sort of start.
Yeah,
We certainly know physical activity is huge, you know, and we know that, you know, increasing our lung capacity and our lung health in advance, you know, that's part of what's believed also to be contributing to worsening outcomes from COVID is sort of the, you know, with the visceral fat comes, you know, fat around our lungs, fat around our heart. You know, unfortunately, our organs are wrapped in adipose tissue. So, you know, that causes a certain amount of compression in our lungs. So, you know, the more we can kind of get out and get active and expand our lungs and, you know, try to work on keeping our weight down, the better our outcome is going to be. Does that make sense? Now's the time to start thinking about it. I always say, you know, you kind of like your immune system is kind of like an army, right? Like you don't want to be kind of, you know, we don't want kind of a wussy army, right? Like we want to sort of outfit it as best we can, you know, so now's the time to sort of, you know, boot camp yourself and, you know, sort of get yourself ready for the best outcome possible, should we encounter it. And hopefully we don't, right?
Yeah, hopefully. So you mentioned, we talked a little bit about flu. This is terrible fall allergy season. People get colds as a matter of course. People are going to get the flu. Some people are going to get COVID. How do you tell the difference and how do you know when it's time to go get a test?
Right. Yeah. So, you know, thankfully there are some really, you know, I guess, first of all, yes, symptoms overlap like crazy. And, you know, I guess, you know, it's really easy to get on the cdc.gov website and sort of you can jump in there and like plug in what your symptoms are. So that's an easy way to sort of COVID screen yourself. I tell people all the time, it's okay to call your primary care office also, because our nurses are trained in helping you sort of differentiate, you know, is this an asthma exacerbation? Do I just have seasonal allergies? Is this COVID? Unfortunately, what we know is 10% of patients are showing up with diarrhea and it's actually COVID. So we don't know entirely. I can say as far as influenza goes, influenza and COVID, the symptoms overlap almost perfectly, with the exception of loss of taste and smell, which sort of seems to be a special little gift that COVID is giving people that, we don't really see with influenza. So, it's really difficult. So those, I guess I would say, seasonal allergies, asthma exacerbations, those things aren't necessarily going to give you fever, right? Those things aren't, so that's an easy way to kind of start to rule things out is, do I have a fever? Because fever sort of starts to get you more in the, the likelihood of COVID certainly is increasing there. The likelihood of influenza is increasing, certainly pneumonia, those things. But your run-of-the-mill cold, usually gives you, can give you a little bit of a low-grade temp, but it's usually not quite as bad. Does that make sense?
Yep, absolutely.
Yeah. Reach out to your primary care office, and they'll help you kind of decipher also, does this indicate testing or not?
Yep. So we have holidays coming up, obviously. We've got Halloween in a couple of weeks. We've got Thanksgiving following that and all of that. How do we navigate that health-wise? What do we look out for? What do we worry about?
Right. Yeah. So, I'm kind of telling my patients to kind of, we're all different in how conscientious we've been, with our sort of masking and, I have the perfect example. I had a patient just yesterday that had a group of about 20 women that they were meeting, pre-COVID, were meeting to play cards together. And because they were all really starting to feel socially isolated, they broke off into groups of 4, which I think is perfect. Pick, a little pod of friends that are sort of equally conscientious. They're sort of in line with how safe you are, that how safe they're being outside of your little circle. And stick with those people. We don't want people so socially isolated that they, we are definitely seeing an increase in mental health problems, worsening anxiety, worsening depression. That's, I guess somewhat to be expected during these times. And, and it's okay to acknowledge that we're feeling that way. So what I'm typically telling people is, if you can try to, do sort of the risk benefit ratio is what I'm kind of saying. There's actually a really good, I always say there's an app for everything, right? There's actually an app that's called mycovidrisk.app. You can put that in, mycovidrisk.app. It was actually generated, I believe, by a medical school. And you can sort of put in that, where you're going, in what part of the country, what you're doing, how many people are going to be there, how many people you anticipate are going to be masked at this event. And it'll sort of say, this is a low risk, or, ooh, don't do it, which I think is kind of fascinating. But I mean, I think we're all, we all at this point, should be making decisions about, yes, I mean, the CDC is discouraging us from having, everybody come to our house on Halloween. So, I think that things like, getting together with one other couple that, are equally as conscientious as you, and maybe doing like a really fun, not classic Halloween by any means, but pumpkin carving, and maybe like a cool, like nighttime scavenger hunt in your yard, things like that, like trying to think outside the box, right? We've done that over the, for other reasons in the past. And a lot of times our kids will say, actually, that was more fun than the usual. So I guess trying to not think of it as this is going to be a horrible alternative to, but trying to think of something that, would be equally, if not in some cases, more fun. There are options. I guess, I think now's the time to start to think about who your equally, conscientious families are, and, start sort of making, those are, if you have families that have kids that are equal, in the same age group as your kids, with the idea being, if you get exposed and you now have been tested positive, there are a limited number of people that you then need to call to say, I exposed you to COVID, you should go get tested. Does that make sense?
Yeah.
Because if I have everybody in the neighborhood to my house on Halloween and I've been exposed in the office, I now need to put out a neighborhood bulletin that everybody came to my house on Halloween, and I might have exposed them all and maybe all of their grandparents to COVID. So, you know, it's about just sort of weighing out there. Actually, the CDC website actually even has a really good whole section on travel. You know, if people are starting to make travel plans for the holidays, you know, depending on where you're going, it gives you guidance state to state, you know, what you should do before you leave. I'm always encouraging people to be really exceedingly conscientious before they leave. And, you know, certainly upon return. But if you know you're going to be visiting family, you know, with some sort of chronic health problems, you know, it's a great idea for the first, you know, for the 2 weeks prior to, you know, hold the kids from their sporting activities and, you know, really be extra cautious. It's not the time to suddenly decide we're going to go start eating out in restaurants.
Yep. Now, a lot of our members obviously are businesses. What can businesses do knowing that, you know, we're working inside now, we sometimes are dealing with the public, dealing with customers. Can you give them some tips for how to keep themselves and their employees healthy?
Yeah, so I mean, I think that, you know, I guess the first thing I would say is avoid some of the gimmicky stuff that's out there. I mean, there are, you know, you're going to be, especially as businesses, targeted for sale of all these special UV lights that, you know, are going to break apart the viral particles in the air. But, you know, what we know is that, you know, most of these are sort of wrapped in mucus when they hit surfaces. And these lights aren't, you know, let's not let them make us overly confident, is what I would say is, you know, what we know is the basics. You know, we know that the masks, you know, sort of, you know, I think from business to business, it's sort of different in how, sort of how we're urging people to be masked. And I think that some businesses are being a little bit more firm with it than others. You know, so I guess, you know, really encouraging your, you know, the people who are coming into your place of business to have a mask on to whatever, you know, degree you're able to. And, you know, masking yourself, not getting overly confident. You know, what we know is that, you know, COVID is mostly droplet, but there's, you know, some potential of it being aerosolized, certainly with, you know, sort of forceful coughing, and in situations where people are singing, you know, so churches is kind of becoming a little bit of a gray area. Churches are opening back up. So I think, you know, that's a little bit of a risk, you know, because people are singing out loud. You know, but I think, you know, sanitizing surfaces. So whatever sanitizer you're using, you know, don't be, you know, finding some little, you know, solution online to sort of, you know, cut cost and dilute it with water. You know, you want sort of the, you know, 60% plus alcohol content, you know, the real sanitizer, right? Not the UV light, you know, lots of hand washing, you know, however you can start to, you know, really get your staff, you know, really good and programmed for frequent hand washing. You know, though it's the basics, you know, you're going to unfortunately keep the masks. If there are ways that you can start to, depending on how, you know, populated your business is, separating people out, right? This part's already kind of been done, but if you're noticing we're all getting COVID fatigue, everybody's getting a little bit more lax. You know, I know myself, you know, myself also, right? We're all kind of starting to get a little bit more lax. So, you know, making sure in your businesses, if you need to put sort of tape in places to keep people aside, you know, away from each other 6 feet, we know sort of the 6 feet is sort of the recommended distance. And so anything you need to put into place now's the time to do it. You know, those are sort of things, you know, you don't want your business to become the place where multiple people contracted COVID or where it was spread, you know, because, you know, we became a little lax and probably lax during the wrong time to get lax. So now's the time to kind of spruce up all those, you know, things that we were really good about in the beginning. I mean, I think, you know, even in, you know, we were all really, really good and fearful in the beginning. And then we've all sort of become a little bit more lax. I know myself, the other day I was noticing my hands aren't quite as dry as they were before. And I was thinking, it's probably because I'm not hand washing quite as well as I was, you know, back in March, April, when we were all sort of just waiting for this, you know, to really hit. So that would be my advice, you know, sort of look over your business. Are you able to keep people 6 feet apart? Do you need to go about measures of sort of scheduling people to come in different ways? You know, could more be done over the phone? Or, you know, are there a lot of businesses are doing really creative things? It's really kind of fun to watch. You know, it's really great because, the businesses who have been able to, accommodate us still having a little bit of quality of life in some ways, right? This many months later, we're all sort of dying to go out to eat or, but we want to do it safely. So it's been kind of fun to watch the progression of how, businesses, we still want to keep you all in business, right? We don't want to, isolate to the point where, our businesses are needing to shut down. So that would be my advice. Hand washing, masks.
Hand washing and masks. Yeah, we're all good on that. Do you have special advice or any kind of tips that you would give to seniors or children? Anything? I know sometimes the kids can be asymptomatic, so navigating that piece. But for seniors right now, going out at a time when things might be going up a little bit.
Yeah, so I think, just like my patient I had yesterday, pick a couple friends, don't isolate yourself. I'm seeing a lot of mental health and, I have a lot of, patients who are incredibly anxious right now and missing connection. They want to see their children, they want to see their grandchildren. And, we have isolated them because we're so fearful of giving it to them. So, finding some happy medium there, right? If you've got a couple of, if you're a senior and you've got a couple girlfriends that, you could sit across the table at and knit together or play cards or something like that. And, maybe they're fearful too, and they're being really conscientious, and the two of you could sort of team up, or, two or three of you. I was really, I went to the beach with my children once over the summer, and I saw a group of 4 women in their sort of, I would say probably 70s. And they were all sitting just perfectly like 6 feet apart, just lounging in the, and they were just chatting away. And I thought, that's the perfect scenario, right? Like you wore your masks down to the beach, you all sat perfect, well distanced apart, but you still, had your friendship and you weren't feeling so isolated. So get out there, try while the weather's nice to still, even if you have to mask up to take a walk with somebody, it's still connecting with somebody. So, I think that, yes, our seniors need to be incredibly careful, but I worry about the other end of it too. I worry about them isolating so much that their conditions actually worsen in some ways, because some of them are very sad. So don't forget your parents and your love, your grandparents in some cases, and find ways to love on them, whether it's via Zoom or at a window at their, a lot of people are kind of getting creative and going up to the windows of their loved ones and or send them little care packages, find ways to love on them. Thankfully they're actually getting really savvy on Zoom. I have several 70, 80-year-old patients. I had one who was 89 the other day that is Zoom savvy. So who knew? So, they can definitely learn and, get good at connecting. But, I keep telling people, just find even if it's one person. Don't entirely isolate yourself. We are medicating an awful lot of mental health right now, and seeing such a rise in it. And so, know that our isolation might get worse and plan for it now.
That's great.
Find a buddy.
Yeah.
I'm telling you, I'm like, just find a friend that you guys, you're sort of equally matched in how conscientious you are. So if you've got a friend that is being equally as careful, and whose families are being equally careful with them, it's okay to have friends, right? We just can't have 20 of them all at the same time. And
not right now, but in the future. Okay, well, Lindsay, any final words of advice while we still have you here?
Yeah, I have a couple questions. I have 2 more questions.
Yeah.
Okay.
The first being, we traveled to New Jersey a couple weeks ago to see my husband's grandparents who were 93 and 95, and we had not seen them since Christmas. We usually see them at least every 1 to 2 to 3 months. We ended up getting tested just to be very, very careful about it, because we did not want to be responsible. And then we were very, very, in between that window, we were very, very conscious of when we were around. But on a lot of sites, they say, don't get tested just to get tested.
Right.
So what is your opinion on that with the holidays coming? you know, people wanting to be with their families about or testing, or how should you go about that?
Right. No, I mean, I think that's a really good question. And, you know, I think, you know, we do have sort of asymptomatic testing, you know, sort of in an algorithm. Yes, sort of travel necessarily isn't in our, you know, algorithm per se, but we do know that they are testing for those things. I mean, you probably didn't get much resistance when you went to get tested, correct?
I wasn't even asked.
Okay.
Like, well, I just went, and my husband had no problem, and we
Yeah. I mean,
paid the fee.
ultimately, if you feel at any point like you might be putting somebody at risk, or if you're going into a setting where, you know, like I had just had a friend whose father just passed away, and she didn't want to go to the, you know, celebration of life, but she also did. And so she was having to travel down to Alabama. And they asked everybody who was coming to sort of, you know, to get tested in advance. And they all did. They all got approved to do it. And so that they were able to sort of safely celebrate life. And I think that that's a reasonable use of asymptomatic testing, right? Testing just because I'm just curious, like I just kind of want to know, like whether I got something at that soccer game the other night. That's different, right? You're testing with an intent of protecting a vulnerable population. So I think that that's very, very different. And I don't think anybody would sort of fault you for that. And I think it's okay also to use I think the CDC website itself uses that as a, you know, if you, you know, feel that that's indicated, and you can certainly navigate the CDC travel website. But in many cases, it is indicated that you get tested. You know, certainly people who are coming up here from Florida, they're getting tested before they come up here. So state to state, there are different guidelines. So I don't know if I can give anybody a real sort of hard and fast. I mean, I guess I would say get on the cdc.gov website. You can get specific guidance based on what state you're going to and the, you know, sort of current outbreaks in that state, and can give you guidance on, you know, your risk, you know, how to best go about even navigating coming home from that place. I think we're all experiencing, even with our own kids in school, you know, my kids can go back to school if they visited these states, but not these states. So, you know, I guess, you know, sort of knowing what your resources are. cdc.gov is an incredible resource. You know, there is almost a calculator in there for everything, telling people. So, you know, all of your questions can easily be answered on there. And I guess the other thing to keep in mind is that our algorithms and advice, unfortunately, are changing as information comes in, like, you know, almost daily. I mean, it's sort of a joke around here. We have, you know, at 2:15 every day, we have a, you know, sort of a phone call update. And a lot of times that phone call is changing our course, or, hey, don't say this anymore, we're saying this instead, or these patients are getting routed here instead of here, or there's new testing guidelines for this subset of our population. So, you know, feel free, reach out to your primary care office or the CDC website to get guidance, up-to-date guidance, because, you know, it's changing, unfortunately, right? Like our lives are constantly in flux, right? But yeah, so I mean, I guess, you know, as far as take homes, you know, sort of, and, you know, all of these sort of benchmarks for your health, just in general, you know, sort of the, you know, making sure you're getting adequate sleep. You know, we know sleep deprivation certainly is you know, has a poor effect on our immune systems. Physical activity, nutrition, you know, don't neglect your mental health. You know, if you are struggling, reach out to us. You know, don't go into the fall and winter where we all sort of like take even like a little bit of a further dive. You know, don't go into that already down. Reach out to us now. If you know, if you sort of checked your My Chart and, you know, you're overdue for 10 different things and you're kind of hoping we're not going to notice, we might notice, but you might slide by. But, you know, you maybe it would be really sad if, you know, you missed your mammogram and we didn't catch something when we should have, and it was for naught, right? Like, you know, you can safely come in here. We're doing our best to keep you safe. So reach out. We also have telehealth. So if you really don't want to come in here, but you're struggling, just ask for a telehealth visit. We have lots of telehealth visits available. So it's okay to do that too. So, you can get on and talk to us for a half hour, and we can sort of help you prioritize what areas of your health need to get addressed now. In many cases, we're meeting with you on telehealth, but we're sending you safely off to get scheduled for some lab work. And then we can call you back and then sort of tuck you in, right? Stay safe. Sort of just keep weighing out, the risk benefit, right? You just keep asking yourself, do you need to go to that place? I think that people are starting to get really comfortable. Get your body sort of well outfitted from immune perspective. Get your nutrition. Now's a great time to get your nutrition on point, and reach out to us if we can help. Okay.
Well, thank you, Lindsay. I really appreciate your time today. I think there's really good information there for people to get themselves ready for these weeks ahead. And again, this will be available probably later today on YouTube, and we'll be sharing it on Facebook. But great information, great advice. So thank you, and stay healthy.
All right. Thank you.